Where low back pain that we see in yoga, especially if it's a result of the practice, is right about here. You see the sacrum is a very big stable piece of bone, and it joins with the last spinal vertebra, L5. Hey gang, Denise here, and we're back with Ask Denise. This is where we go into some common issues that we see in yoga, and we look at, how do we understand that a bit better, and what are some of the things that we can do about it, staying within our scope of practice as yoga and movement teachers. All right, so today my topic is low back pain. This is actually a huge, big deal these days. So many people talk about having low back pain. For some, it's kind of a chronic, low-grade kind of issue that just sort of gets acute for them every now and then. It gives them a little more trouble. And for some people, it's so debilitating that they can't even work with it. It can be that bad. So there's a broad range. There's many different sort of mechanisms that would cause low back pain. And it can be, completely non-physical in nature. But most low back pain does have some kind of manifestation that is a physical result from especially our movement habits, and our lifestyle habits. So I'm going to go over some of that with you, but just keep in mind that what I'll focus on are what we'll see most often in yoga, and that's not necessarily the same thing you're going to see in other sports or other activities, okay? So what we want to do as movement and yoga teachers is focus on developing good movement habits in our students. We'll work on establishing those skills, making them habits so that our students can kind of stay out of the weeds with a lot of orthopedic issues, okay? Now there are, healthcare professionals that can assess and treat low back pain, but here's the thing that happens to us as yoga teachers. They'll have been under the treatment of a doctor or a chiro, physical therapist, and then they'll show up in your class and they'll say, yeah, I have low back pain and my doctor said yoga would be good for me. And then the yoga teacher's supposed to take it from there. And as yoga teachers, what does that even mean to us? Okay, so I'm hoping to help you out with that a little bit. So where low back pain that we see in yoga, especially if it's a result of the practice, is right about here. You see the sacrum is a very big stable piece of bone, and it joins with the last spinal vertebra, L5. So this L5, S1 junction right here, and I'll show you on the front side, is often where we get some hinging. That is not ideal, okay? Because that's actually supposed to be pretty stable, but anytime you find a really stable part of the body meeting up with a bit more flexible part, you're going to have a vulnerable area. And this ends up where we try to hinge a little bit when we aren't getting the hip to do the hinging. Okay, so there's a lot of forward folds and a lot of single leg and double leg actions that ask for hip hinging in yoga. And if we aren't actually able to successfully hinge at the hip, what we're going to do is ask this area, sometimes it's the SI joint, but it could also be this lower lumbar vertebra, these last couple, where we ask it to hinge. So we're basically trying to put a hinge where it doesn't belong, okay? Putting in a hinge in an area that's supposed to be more stable. This hinge should be at the hip. So I see that as a pretty major problem with some of the movement mechanics we see in yoga. I'm going to refer to my notes because I have so much to say. Now, what would that feel like? It could feel kind of just achy, or it could feel like a pinch that happens kind of suddenly. It can also be like where you notice your body avoiding certain movements because it's trying to avoid pain. So you get all kinds of compensation patterns. It could go into spasm. So the muscles that are meant to stabilize that area can go into spasm. And often that will happen like after a period of rest, after you've been sitting or even lying down for a while and you go to get up or make some kind of movement, you'll get a spasm. So people will often have that experience, but what doesn't happen is they don't usually feel it in their practice that much, because when they're moving, their body's warmed up, that we're just less sensitive, okay? So that makes it hard to sort of track down. Okay, so you know what we can also feel like right here is like, if I could just stretch that enough, it would feel better. But don't be misled by that feeling, because that is not going to help you. So I want to give you some solutions. Now, people who come down with low back pain, oftentimes there's a movement mechanics issue. So there's, like I say, they're not hinging at the hip or something. People who sit a lot, or people who prioritize flexibility in the spine and the body in general over stability. This makes us vulnerable to issues like that. So number one reason it's happening, not flexing at the hip, causing flexion somewhere else, or asking the hip to flex beyond what it's able to flex, and then you try to borrow some flexion from somewhere else, okay, like the spine, okay? And where I see this a lot, and as a movement habit, is in forward folds, half lift, and coming up and down from those positions. Okay, so I'm going to demonstrate that really quickly for you. If people have the idea in their head, and I think a lot of our students do, especially when they're new to the practice, they think their legs are supposed to be right together, their knees are supposed to be super straight, and they're supposed to come up and down in those positions with the knees, you know, as straight as they can be and the legs stiff. Can you feel this in your body? You really need to try this out. Where are you going to feel the stress? Look, this makes my half lift position looks like this. It makes me coming up and down look like this. Doesn't it look like I'm rolling up and down? When you do that, you're going to put a lot more stress down here. Okay, so that I see as a big problem. When you are trying to keep your legs super straight, it's much more difficult to get full flexion at the hip. People see this. You see how I just sort of tucked my butt under? So we get people tucking their butt under, and this is putting a lot of strain here. You can probably even notice that visually. So that's a big problem. And then lots of these forward folds, there's too much emphasis in those folds on stretching. We're always trying to stretch our hamstrings. Where did we get this idea? It's so crazy. So, you know, your hamstrings are fine. Just bend your knees a little bit. Okay, that changes everything, and it helps you strengthen your superficial back line. We're always trying to stretch the superficial back line. That is our backbone of the body, and it needs to be strong, and it needs to not be a puddle of meltiness that just lets us flop around. You're going to get muscle guarding somewhere if you let that happen. Okay, so how can we prevent this? Number one, you got to organize and activate. This is what I'm always teaching you about, okay? Organization and activation is this. When we stand in a basic standing pose, great toes straight ahead, heels a little wider, feet can be together or apart, but it's not this orientation, okay, guys? This way. Straighten it out, your feet can be apart, dial the knees away from each other, energize your feet like you're trying to dial them away from each other. You're going to find that this really lights up these lateral support lines in the body, and you're going to be able to flex your hips if you let your knees bend a little bit. So just look at the effect this has on my half lift and rising up and down from a forward fold, okay? So in my half lift, we'll take this view from the side. My half lift with a little knee bend is going to look like this. If I'm dialing my feet and knees away from each other, I'm going to be really supported. This allows me to express the normal curves of my spine, and look at my hip is hinging. That's as opposed to this, where my hip doesn't want to hinge. You see that? If I let my knees bend more, it takes some of that ultra stretch out of the hamstrings and allows me to align my pelvis and spine correctly. And now watch what happens when I go up and down from that half lift. So we usually go half lift, we fold again. See, you can fold with your knees bent, and then you're going to power up. Okay, so powering up and down. Try this in your body and compare it to what this feels like. Coming up and down like this. You'll notice right away, if you do this, you're going to hinge right here. If you do this, you're going to hinge at the hips. And now you can use the power of your muscles in your legs instead of just tensioning your connective tissue all the time and hinging right here. Okay, you've got to use your muscles to tension fascia, not just the weight of your body to tension fascia, okay? Great, now, What are you going to do in your class? So you're going to watch for that and cue that. But here's another really strengthening posture. Set up with a band, step into it, practice that dialing outward energy that I just talked about. Okay, and working with things like chair pose or squatting up and down in this position is great. But I'll tell you, one thing the body really understands, and I've worked with runners and stuff who have a really hard time hip hinging, and what helps them is dialing out into the strap and then reaching back with their tail. Trying to reach back, because that creates hip hinge. You can't reach for the wall if you're going to tuck your butt under like this. So this reaching back, give the body a target, reach back, okay? And that helps you get your everything into alignment. So I want to invite you to try that. Remember your half lift, little bend in the knee for forward folds, and then learn to power up. Cue your students to get that power up. It makes a difference, especially if they have low back pain. I've worked with students and that has immediately corrected the problem for them. And they've started getting stronger right after that. So just something that is within your scope of practice, easy to implement in your class, and it works for everybody, not just people with low back pain, okay? I really strongly invite you to give that a try, okay? I invite your questions, comments, and let me know how it goes for you, okay? Thanks for joining me. Bye for now.